follow the ball protocol until it gets to a point where it says call the nurse and then call the nurse. Anytime you need a PRN, if somebody is in pain or they're crying, they're isolating themselves, you notice an increase in certain behaviors, or they're aggressing towards other, I would call the nurse. It might be an indicator of pain. If somebody's complaining of chest pain, if they're favoring a limb, medications. Any medications, if a new medication comes in and you're not aware of it, call the nurse. If the medication label doesn't match what the MAR says, call the nurse. If there's a change in the dose, if we run out of meds, if the pills look different and there's not a label on there that says this pill may be different but it is the same, always call the nurse. Anything in regards to a medication, I would say call the nurse. Better to be safe than sorry, you know. Anytime you would want to give a PRN, or if you give a PRN and there is no effect at the follow-up prompt, then I would call the nurse. In regards to backlip and nobody here has backlip and pump. No. Okay, so we'll just skip that part. Nobody here has a VNS, so we'll skip that part. Nobody here has oxygen, we'll skip that part. Nobody here has a CPAP, we'll skip that part. In regards to the tube feeding, now I know Olivia's tube is a little different than norm. The way the gauze is set up for hers is it's much thicker when it goes around the tube. That's not normally how we would do it at another house. The reason why it's like that is the tube is so long for her, she's so little, that if you don't have it pulled tight, it will literally flow right out. So that's the theory as to why it is the way it is. If you're noticing a odd colored drainage coming from the tube, excessive saturation, by excessive saturation, I would say if you change the pad once and do it correctly and you're still having excessive drainage, then I would call the nurse. For Olivia, a lot of times, if she's getting sick and she goes downhill fast, her tube leaking is the first indication that she's getting sick. And her dad usually likes to be notified and he'll come out and assess her. If the water flushes won't go through, if it seems to be clogged, if she has too much residual, call the nurse. If the area is red, weeping, she has a rash, if the feeding is missed, if you don't have supplies. Another thing that you would call the nurse for is anytime you do an appointment and there's, you know, and I would just call the nurse anytime you have an appointment and come back, even if it's just to say there's no changes. I would say other things would be significant behavioral changes. The other thing that Phoenix has instituted is you do not need nursing approval to call 911. If you ever feel you need to call 911, you have the authority to do that on your own. But the nurse would prefer to be notified after you call 911, please. So just so that they're in the loop. And I think that covers the majority of it.